Tell me, what inspired you to be a nurse, and in what ways do you believe this company and position align with your professional goals?
My inspiration to become a nurse came from many years of working in physical medicine and rehab, particularly at this veterans hospital. While I really loved regaining the patient's mobility and working with their physical beings, I knew that I wanted to provide more care, more patient centered care, and really be more involved in advocacy and their entire medical well-being. So that's what encouraged me to take the opportunity to change my profession with physical therapy into the profession of nursing. The position with the VA here aligns perfectly with my professional goals. And after working at the VA for a few years now, I understand and deeply appreciate the VA's mission. And that mission directly aligns with me with their holistic, veteran forward, compassionate care that we provide. So I found that even though I am changing professions, the mission only, how would I say it, grows deeper.
And what are your short-term and long-term professional goals?
My short-term goal so far, after graduating as a nurse and taking the NCLEX, is to complete the RNTTP program, which puts me directly in line with many different aspects of the VA, med-surg, with ICU, step down, even physical medicine and rehab, as well as I think there was some of the outpatient clinics. So I wanted to complete that engulfing year, and then from there transition long-term into the possibility of a physical medicine rehab nurse that would actually continue the care from their inpatient status to their rehab status.
Great. Describe a challenging situation involving a patient during your clinical or past healthcare work experience, and how did you resolve it?
I can recall having a patient who had just recently lost their leg, and they had completely given up on their rehab altogether. They felt they were a burden to their family. They didn't even want to participate anymore. They lost their dignity, their self-worth. So I listened to them, a lot of therapeutic listening, and instead of focusing on what they couldn't do, I focused on what they could do. With that, because the VA is patient-centered, veteran-centered, veteran-forward, we were able to align this veteran with a certain care that he required, whether it be social services, counseling, anything to bring his mental state up with his physical state. So when we address that both together, he was able to move forward and then achieve small incremental goals.
Describe a time when you had to adapt to an emergent change in patient condition, situation, in the clinical environment.
I feel this happens a lot. One of which that I can recall was in the ICU. I had a CABG patient, and part of my job is to initiate ambulation with these patients. And that's what we did. And this particular gentleman just wasn't looking as spry as he should. So I grabbed a wheelchair. We got him up, had him walking, which he then started to complain of shortness of breath, chest pain. So with that goes from therapy to emergent. We sat him down, called a rapid response, and got the right team in front of him. With that, because that's in a sense where my position ended, I was able to collaborate with the nurses, and I was able to collaborate with the doctors to give him and them the triggers that may have caused this so they could tailor his treatment better to his needs.
And how do you prioritize self-care and maintain your physical and emotional well-being in this demanding field of nursing?
My many years in healthcare has taught me that burnout often happens, and if we ignore these warnings, we could potentially put ourselves in danger and our patient care compromised. So I prioritize this by obviously listening to my body and my surroundings, and I combat that with, when I'm not at work, take the time, take a walk, get a bike ride, anything that would recharge and reset from the stressors. Obviously, good sleep is a big deal. And just know your limitations, because again, if you're not taking care of yourself, you're not going to be able to provide the care to the patient that they require.